To introduce myself, my name is Matt Ogan. I work with the American Cancer Society, so thank you again for welcoming us into your community. Allison?
Hi everyone, my name is Allison Schur. I co-led this event with my friend Caroline McCoy. She's been really great with helping and everything. And before we start, we just wanted to say happy birthday to Matt Ogan. He's been a really great help and everything. And so if Courtney can help us sing happy birthday to him, we have a cake that we will cut and pass around.
Alright, you all know happy birthday. Alright. Happy birthday to you. Happy birthday to you. Happy birthday, dear Matt. Happy birthday to you.
Okay, so people, you guys all should be getting cake around. Someone will pass around cake. We have a limited supply, so I'm sorry if you don't get any, but it should be being passed around now. So these past few years starting relay have been filled with ups and downs, but it really has been the best experience of my entire life. I would not regret any part of it. The life lessons that I've experienced taught me so much, not only about myself, but my community and the real world. Thank you for making all of this possible and supporting this amazing cause. Already, we have raised over $23,000 that have helped to end the fight against cancer. I know that this cancer will end one day and we will no longer have to continue the fight. With your help, we will soon see the day when we no longer have to hear the words, "You have cancer." The American Cancer Society has been working incessantly since 1985, when Dr. Gordy Klatt decided to run for 24 hours, covering 83.6 miles for charity. He raised $27,000 that night, yet sadly passed away in 2014 at the age of 71 from heart complications in his own fight against stomach cancer. However, Dr. Klatt's fight still lives on through all of us. The American Cancer Society has been able to supply a countless number of services to cancer patients and their families during treatments and recovery, such as Hope Lodge, Road to Recovery, Look Good, Feel Better, and Reach to Recovery. These services provide care to patients by staying in rooms at certain hotels and Hope Lodging buildings, specified transportation, self-image chips for those who are self-conscious, and support. American Cancer Society's Relay for Life has raised almost $5 billion over the course of 30 years, and relayers are not slowing down anytime soon. When you hear the words, "You have cancer," "Your friend has cancer," your heart shatters, your stomach drops. Even though I don't remember the exact times I was told, "Your grandfather has cancer," "Your grandmother has cancer," "Your friend has cancer," I remember the long, grueling processes that followed for them during their fight. My grandfather died of lymphoma when he was 67 years old, while I was just 8 years old. The process, I'm sure, was long, tiring, and cruel, not only to my grandfather, but his loved ones. He fought for nearly 8 years, but his fight will never be over. My friend's friend died of brain cancer when she was 19 years old. When she was diagnosed in the beginning of her senior year of high school, her world fell apart. One day, she mysteriously couldn't pick up her left leg, and once they went in for an MRI, she heard the dreadful news of "You have cancer." Her fight involved radiation, clinical treatments, and a plethora of hospital visits. She fought for a year and a half, but her fight will never be over. My grandmother was diagnosed with uterine cancer only a couple months after my grandfather, her husband, passed away. At the time, I could only wrap my head around the fact a little bit. I struggled to understand since I was so young, and because the same disease just took away my grandfather less than a year before. I was scared out of my mind. I didn't know if I would have to go through the same exact process with my grandmother, but I prayed that she would be okay. Nearly 7 years later, I am so overjoyed to say that she is completely cancer-free. Cancer takes the people closest to us away, sometimes without the chance to say goodbye. Through American Cancer Society's Relay for Life, I have found closure and peace, knowing that I have done something to help. This organization has done more for me than anything else. Thank you for coming out tonight to support American Cancer Society and all that we've done, and together we will end this fight against cancer. And now I would like to introduce my co-chair and the one who helped make this all happen, Caroline McCoy.
Hi everyone, I'm Caroline McCoy and I'm the co-chair along with Allison. I would like to thank everyone for coming out and participating in this great event. Cancer has affected all of us some more personally than others. When you hear the words, "you have cancer," your heart sinks and you feel like nothing is ever going to be all right again. No one should ever have to hear the words, "you have cancer," ever again. Tonight we are here to fight back and end cancer once and for all. And now I would like to introduce Moorestown's Mayor, Victoria Napolitano.
Hi everybody. It's really an honor for me to be here today with our Deputy Mayor Phil Garwood to cut the ribbon on this event and declare Moorestown's Relay for Life officially open. First of all, I want to thank Matt Ogan with the American Cancer Society and also Mr. Jason Hicks with MHS, and especially Allison Schur and Caroline McCoy. Let's have a round of applause for these young ladies. We all know of Moorestown as a place where people are willing to come together for something bigger than themselves, but we needed these two young ladies with the willingness to step up and to make this happen so that we could all come and be a part of it. So congratulations, ladies. As it's been said, I'm sure everyone here has been affected by cancer in some way. I know I have. But today's event is, it's about remembering those who we have lost. It's about celebrating those who are still with us, and also remembering the struggles that they went through to stay here. And most importantly, it's that every step we take today is raising money so that we can take more steps towards finishing the fight against cancer. So everyone, have a great time today. Remember why we're here, and again, congratulations, girls, on putting together this event. I think it's going to be great, and it's going to be the first of many Relays for Life in Moorestown.
And now I would like to introduce the one who made this really all happen, and without his help, we would not be here. So Matt Ogan.
And thank you so much, Allison. And I'm going to kick it directly over to my supervisor, who I'm very honored to introduce, Debbie Cooney, and she will speak on our honorary healthcare providers who will be visiting us today. Thank you. Debbie, please.
Hello. Hello. All right. Let the neighbors know you're here. Hello. All right. My name is Debbie Cooney. I'm the Senior Manager of Relay for Life for Southwest Jersey. I am so excited to be here today at the very first, and hopefully, like the mayor said, of many more, Relay for Life of Moorestown. I would like to take this time to introduce two very special guests. Recognizing that our healthcare providers play a very significant role in the lives of cancer survivors, I find it only fitting that they are invited to join us at the celebration of survivorship at our Relay for Life events. Like family and friends, they too are caregivers to those facing cancer. The doctors, nurses, social workers, lab technicians, and office staff all become a part of that caregiving network as soon as someone hears those words, "You have cancer." Our healthcare providers are part of our team, and like any team, the only way to win is to work together. Our healthcare providers offer support and life-saving treatments, but the money you all raise funds those treatments. It helps to provide rides to and from the offices, and it puts Look Good, Feel Better programs in their treatment centers. There is no doubt that our healthcare providers are a part of our Relay for Life team. And today, I would like to welcome two very special doctors to our Moorestown team, Dr. Greenberg and Dr. Shaw. Dr. Greenberg and Dr. Shaw are oncologists at Regional Cancer Care Associates of Cherry Hill and Mount Holly. Dr. Greenberg, Dr. Shaw, on behalf of the Relay for Life of Moorestown, I would like to recognize you for your continued commitment to excellence in the provision of oncology care and all that you do in the fight against cancer.
Thank you.
I would also like to thank them for being sponsors for this and two other Relay for Life events.
Well, thank you, everybody. I'm Dr. Rich Greenberg. This is Dr. Deval Shah. We're both medical oncologists. We may know some of you and some of your families. It's our honor and pleasure to be here today. We're really thrilled that the American Cancer Society is able to expand the Relay for Life program. Both of us are physicians, part of the Regional Cancer Care Associates, a group of medical oncologists, the largest practice in the state of New Jersey. And we've been longtime supporters of the Cancer Society, and the Cancer Society has been wonderful supporters of our patients. As Debbie pointed out, the programs of the Cancer Society, whether it be research or prevention or support, are wonderful, and we're very glad to be part of that. And we just want to bring the care we give in the office out to the community. We want to let you know that we really care and that the care continues to your families and to your communities. And we're really very thrilled to have this program start here in Moorestown, and we want to offer our support.
Thank you, Dr. Greenberg. Thank you again for inviting today for this wonderful day. It's an honor to be here today. As already has been pointed out, all of us are here for one or the other reason, and we all know a lot of research has been done over the past 30-40 years, and the progress has been made to fight against cancer. However, we still have a long way to go, and it is only because of events like this and from your support that we can continue to provide the care for our patients. So thank you again, and you all should be very proud of yourself. Thank you.
Thank you. Thank you, Doctors Greenberg and Shaw. We appreciate it. And per our wonderful relay tradition, we will be kicking off the event with our Survivors Lap. Survivors, we ask you to step forward to receive your medal, and then you'll proceed past our wonderful cheerleading team here to make your way onto the track, and you can begin your lap around. Halfway through, we invite caregivers to join the survivors, and as for the rest of you and all of us here, we'll be cheering along everyone for that Survivor Lap. So survivors can please make their way to the stage, and we'll give you your medal, and then we can get rolling on that Survivor Lap. Thank you so much for coming out.
father is. He's over in that white tent on the other side, and I think there's another older tent.
Okay, we'll bring these over to them. Okay. Okay, absolutely. I'll take that over to them.
Thanks.
Thank you.